people are also getting awareness and coming forward into these procedures and believing in that in India also.
Absolutely, yeah.
So what are the biggest challenges right now you are facing in the reproductive industry, sir? And what are the changes you want to incorporate or you are thinking that should be coming into this industry?
I have a very particular vision about this, I think. I mean, everyone has a different opinion, I guess. But one of the main challenges is that everything is moving very fast. Yeah. So infertility is growing very fast. Yeah. And we need to be able to adjust to that demand, which is not easy. Yes. That's number one. It is increasing because of lifestyle. Because of lifestyle, we are also postponing our paternity and maternity. And we have more issues to be fertile and to have children. And because this is increasing, we need to adjust to that demand again and to have these services to all our couples. So we need to make this also affordable, which is point number 2, to make it also affordable. But at the same time, I think that the main issue is all about information. We, as an expert in infertility, we know how important time is also in this biological clock. And I think we need to give more information somehow. We need to spread this information as much as possible about the different options you have, like oocyte preservation, but also about different information about what this parenting is about. Because you need also energy to be a father. I have 3 children and it is exhausting. It is very intense. You need that energy also. So if you want to make a decision to postpone paternity, you need to be aware also about the implications on that. And we need to give all the information, and then you can make the right choice. But information, I think, is one of the main challenges in our field, because still there is some taboos in society about the IVF, about these things. But it's not just about IVF, it's about parenting, upbringing. We need to give all the information, because we are experts on infertility, but some of us are also parents, and we have all this information about parenting, and we need to give all this to our society somehow. Not to the patients, to society. So they have all the information, they are aware of that, and then they can make the right decision.
So what is ICSI and why is it used in IVF, sir?
That's the origin of everything in the laboratory. When we talk about IVF, we have basically 2 different techniques in vitro fertilization. One is something, let's say, more natural, more conventional, in which you put together oocytes and sperms, and then the fertilization happens. The other one is about injecting inside the oocyte the sperm. This is ICSI, which is intracytoplasmic sperm injection. So we put the sperm inside the oocyte, so we are mimicking what happens naturally in the body. Naturally. And then we are helping those oocytes to get fertilized with the sperm. So it's the cornerstone of an IVF clinic to do this ICSI procedure.
So how embryos are graded for quality purpose, sir?
That's also important. I mean, we need to have that knowledge. Right now there are pretty well established grading systems for embryos and for blastocysts, but you need to have that skill in your eyes and in your expertise to see the quality of the blastocyst and to choose the best one for the patient. So grading systems are available. We have those systems everywhere, but we need to have people who are well trained in these gradings to have this knowledge, but also this interpretation, these criteria about the embryos, because embryo quality is very well linked to pregnancies. So the better the quality in the embryos, the better the pregnancy rates. But we need to have this criteria and this grading in place.